To CARNA's speaker series. My name is Patrick Chu. I am one of the practice advisors at CARNA, and I'll be facilitating today's webinar. So this month, we're joined by our nursing colleagues from the Canadian Association of Nurses for the Environment, who will be discussing planetary health and nurses' involvement in this emerging field. We're joined by 3 speakers today. So Maya Kalogirou, who's a registered nurse with a clinical background in the emergency room. She also holds a PhD in nursing from the University of Alberta, and her program of research focuses on climate change, health, and nursing practice. We're also joined by Raluca Ridu, who's a registered nurse who has worked in diverse nursing roles and is currently a lecturer for the BSCN program at the University of Alberta, or University of British Columbia, I should say. And Fiona Hanley, who is a nursing instructor and a passionate advocate for nursing leadership in environmental and climate health. She's also a member of the Quebec Order of Nurses Climate Committee. So I'm going to hand it over to the speakers. If you do have any questions throughout the session, just feel free to type them into the Q&A or chat box. We'll try to answer them at the end. The recording of this webinar will be posted on our YouTube channel within the next few days, so please feel free to come back and view it at a later date. So with that, I will turn it over to you, Fiona.
Okay, thank you very much, Patrick. Can you hear me okay?
That's great, yeah.
Okay, so I thank you very much for this opportunity to speak with you today. We are really pleased to be able to talk about planetary health and nursing on behalf of the Canadian Association of Nurses for the Environment. We have a fairly short time, so we will talk about a few aspects of some of the environmental issues we're facing and give some thought to what each and all of us can do in confronting this crisis of planetary health. And I want to say that the COVID-19 pandemic that we are currently experiencing did shift some of the attention away from the climate crisis, but has also triggered reflection around the globe on how we can best rebuild and restructure our societal and economic and health priorities once the pandemic comes to an end. But the urgency for climate action certainly still exists. And you might have seen a recent poll that was published by the UN Development Programme with the University of Oxford. And this poll found a majority of people in 50 countries recognize climate change as a global emergency. And many of those believe that we need to do everything necessary and urgently to respond. So now is a very opportune time to help people understand links between health benefits and climate action on an individual, societal, and planetary level. Next slide, please, Raluca. We would like to start with a land acknowledgement, which I will read. So we recognize that Indigenous peoples are the custodians of the lands and waters where we live and work. We respect the continued and sacred connection with the past, present, and future in our relationships with Indigenous peoples, as we embrace a renewed bond with Mother Earth and all that unites us. We commit to redressing harms from colonialism through strengthening our knowledge of and relationships with Indigenous peoples where we live and work, as well as anti-racist practice and advocacy. Next slide, please. So today we plan to tell you a little bit about our organization, CANE, and describe some of the complex links between our environment, our climate, and our health, especially in the context of Canada and Alberta, and also tell you about this surging global initiative called Planetary Health that is uniting multiple disciplines together, centered on the connectedness between human beings and the environment, and sharing ideas of how we move forward in confronting the multiple challenges of climate and environmental deterioration. And the voice of nurses is crucial in this work, so we hope also to give you some ideas about what you can do and how you get involved. Just to say, that a little bit about CANE as well too. This is, our association is called the Canadian Association of Nurses for the Environment, and represents nurses dedicated to the improvement of environmental health across all aspects of nursing practice, policy, research, and education. CANE is a member of the Canadian Network of Nursing Specialties of the Canadian Nursing Association, and includes all practicing nurses, registered nurses, licensed practical nurses, or equivalent, psychiatric nurses, and nurse practitioners. You can see we have all of these various different aspects that we try to cover. We do also collaborate very actively with different like-minded organizations, such as the Canadian Coalition for Green Healthcare, the Canadian Association of Physicians for the Environment, and partner in activities and calls to action from different organizations that are aligned with our goals and mission. And one of the things is we have provided a link in a later slide about one of our latest projects, which is the Nurses Climate Challenge. And CANE worked on this with our American colleagues to create a very full toolbox of resources for climate and health education, which you might have a look at later. Next slide. So thinking about the interconnections between our environment, health and well-being certainly goes back a very long way. And in ancient Greece, over 2,000 years ago, Hippocrates advised physicians of the day to consider people's health in the context of where they lived, what the season was, and the quality of water and air. Florence Nightingale, who we well know as the founder of modern nursing, like Hippocrates, also believed in the contribution of environmental factors to health and well-being, and argued that a healthy environment was important to healing, and that the provision of health, fresh air, of clean water, of adequate sanitation, good food, quiet, and cleanliness was essential to patient recovery. And certainly, in addition, her legacy of leadership, of advocacy, her analytical abilities and courage still has many lessons for us today. Of course, beyond Hippocrates and Nightingale, there's a marked evolution in health sciences, but also increasingly now in recognizing the importance of preserving healthy environments, not only to optimize human health, but also recognizing the importance of preserving nature for its own sake, and that non-human things have intrinsic value and rights outside of their usefulness to humans. So understanding about the importance of the human-nature connections has really burgeoned into this ecocentric, holistic perspective of planetary health. We also recognize the profound spiritual connections to the earth and nature of Indigenous peoples over time as caretakers of the earth, and the interconnectedness of mind, body, and spirit, and Indigenous resilience in confronting colonialism and systemic racism in the defense of their rights and lands. So I hope that there is at least one Indigenous nurse who will be joining us today, or who can listen to this webinar, who can join our discussion possibly. Something is very profoundly wrong with the way that we continue to relentlessly damage the planetary home that has sustained us over time. And certainly dramatic weather events of recent years have heightened the sense of the fragility of the ecosystems that have sustained us through time, and whose resilience until recently we've really taken for granted. But effects of the acceleration of human-driven changes are now clearly visible to us, with human activities influencing all components of the global environment, the water systems, the air we breathe, and the land that we dwell upon. And everyday nurses are witnessing the effects of climate and environmental deterioration on their patients directly or indirectly. Next slide, please. So I would think that probably some of you are quite well versed in the basics of climate change and greenhouse gases, but I'm just going to make a fairly brief explanation, so please bear with me on this. So we know that the Earth's atmosphere is composed of different gases, some of which are called greenhouse gases, so carbon dioxide or CO2, methane, water vapor, nitrous oxide, and ozone are they represent this type of gas. And greenhouse gases are essential to life on Earth and surround the Earth a bit like a blanket, with the ability to trap heat from the sun and warm the planet. So what's known as the natural greenhouse effect allows the Earth to maintain a stable temperature of about 15 degrees by reflecting some of the sun's rays, mostly from snow and ice, and also absorbing enough to warm the ground and the air. And without this process, our temperature would be closer to minus 18 degrees on average. The temperature at the Earth's surface has been gradually increasing since the end of the 19th century, especially in the polar regions. And temperature records kept since around about 1880, which is when the time when records began to be very reliable, show that this warming trend is breaking records over different years. Last year, for example, 2020 tied with 2016 for the warmest year on record. The main cause of this increase is the increase in man-made greenhouse gases, mainly CO2. And the higher the atmospheric CO2, the higher the Earth's temperature increases. According to the IPCC, which is the international body responsible for assessing and reporting on climate change, each of the last 3 decades has been successively warmer at the Earth's surface than any preceding decade since 1850. Of course, there have been variations over time in the Earth's climate, and these are attributed to things like how the Earth tilts, the orbit around the sun, ocean currents, and volcanic activity, but none of them can explain the dramatic global warming in recent years. And over the past 200 years, we have seen an acceleration in the burning of fossil fuels like coal or oil or gas for energy, for transport, for industry, for agriculture, forestry, land use, consumer goods, etc. And so this has raised greenhouse gases to unprecedented levels, thickening that blanket, if you like, and so increasing the concentration of CO2 in the atmosphere. And ice core samples indicate that the current amount of CO2 in the atmosphere is the highest in 800,000 years. So that was long before any human being lived on the Earth, and at a time when sea levels were hundreds of feet higher than they are today. It is estimated that global temperatures have increased by about 1.2 degrees Celsius, and certainly current climate policies put the world on track for much bigger increases by the end of the century. For many people, 1 or 2 degrees of temperature might seem insignificant, but nurses understand that what seems like a small shift in temperature can have important systemic effects, and this is the same with the Earth, essentially. So a special 2018 report from this same body, the IPCC, made it clear that just about how important it is to keep warming below 1.5 degrees Celsius to avoid catastrophic challenges to life on Earth. As we enter well into the 3rd decade of the 21st century, we are losing the stability of the Earth's systems that have allowed humans to thrive over thousands of years. And in fact, we have so altered the structures and functioning of planetary systems that the International Union of Geological Scientists agreed in 2016 to actually change the name of our epoch from Holocene to Anthropocene, or the age of humans, to really signify the imprint that we are leaving throughout our planetary systems. So that this imprint has has really spread across the globe from microplastics and chemical pollution that have wended their way right down into the very deepest cellular levels of human and ecosystem life, but also, of course, with a big macro level of ocean, coastal regions, mountains, river systems, and atmospheric changes. And along with these human-driven changes, there are multiple cascade of effects that stretch the ability of these systems to sustain future generations, with consequences on the health and survival of humans and ecosystems now and in the future, as Maya and Raluca will explain. And I think just in the context of the pandemic that we are currently experiencing, this is actually very closely linked to the environmental and climatic disturbances, because the origins of the coronavirus really lie within environmental deterioration, increasing proximity with wild animals, increasing industrialization of agriculture and deforestation, the loss of these undisturbed wild places, but also reflects the inequity in terms of who is most vulnerable to COVID, what kind of social and political forces influence their vulnerability or resilience. Next slide, please. I'll hand it over to Maya now.
Yes, thanks, Fiona. So above you will see an image that's from an article that came out around 2015. And just in the same vein of considering our impacts, as Fiona has been mentioning, it's helpful to consider our impact in like kind of the framework of 9 planetary boundaries. And that's what the above image is showing you. So if you go and you look at the bolded headings there, each one is a planetary boundary. The green zone is the safe operating space. The yellow represents a zone of uncertainty, so increasing risk, and the red is a high risk zone. The planetary boundary itself lies between the green and the yellow. So as you can see, there are 9 different boundaries, but 2 of them, climate change and biosphere integrity, are recognized as core boundaries based on their fundamental importance for the Earth system. We're going to be spending most of our time talking about climate change specifically in this presentation, but it is important to understand that climate change is just one of several concerns that face humanity right now, and it's just one of several boundaries that are getting pushed. When we talk about climate change, we will sometimes talk about other concerns as well that may or may not directly impact climate change, but they will still impact these boundaries. And so, for example, one could say plastic pollution. It doesn't, once it's in the ocean, it doesn't necessarily have an impact on climate change, but it does impact ocean life and biodiversity. So sometimes there are crossovers that are relevant, and that's going to be especially important to consider when we talk about solutions and actions. So we'll go to the next slide. And above you see an image that is taken from that group that Fiona mentioned, the IPCC. So that's the Intergovernmental Panel on Climate Change. And what they're considered an authority on climate science. And this image is, like, what you can see is that there is a map of the world, and there is an overlay of the different effects of climate change on different parts of the world. And what this is showing essentially is that climate change does not affect each place equally. Depending on where you live, you may experience different effects. And so while it is difficult to summarize all the ways that climate change impacts our planet and life on Earth, the IPCC distinguishes the impacts in 3 main systems. So the physical systems, biological systems, and human and managed systems. That last system is going to be the main focus as well of our presentation because it includes human health. So if we'll go to the next slide, we'll just focus on how climate change impacts Canada generally, and then we'll go into health in a bit. But like I said, climate change impacts places differently, and Canada is a very large country, so depending on where you live, you may experience different climate change effects. According to the Government of Canada's climate change report, Canada is warming at about double the magnitude as the rest of the world, and greater increased temperature means have been observed in the north, the prairies, and northern BC. This has resulted in major changes in precipitation patterns, where many parts of Canada receive increased amounts of rainfall and generally less snowfall, as well as changes in extreme temperatures, where warmer temperatures have become hotter and colder temperatures have become less cold. This warming has led to decreases in summer sea ice, thinning glaciers, warming of permafrost, decreases in freshwater availability during the summer. Not to mention, the oceans surrounding Canada have also warmed and become more acidic and less oxygenated. Melting ice caps are causing sea levels to rise, and coastal flooding is expected to increase in many areas of Canada along the coast. So let's focus on Alberta next. Alberta's emissions have increased 15% from 2005. Alberta's greenhouse gas emissions are expected to peak in the early 2020s, so I guess that's kind of now, and we'll see where we end up, in that kind of in that place. But really, from all of our emissions, oil sands make up about 26%, electricity and heat generation make up about 18%, oil and gas and mining make up 17%. And the rest come from heating our homes and businesses, transportation and agriculture, forestry and municipal waste. So you can see on the slide that the government, these are from the Government of Alberta website, and they list several ways in how climate change will impact Alberta. And it will likely result in long-term changes in temperature and precipitation, as well as increased frequency and severity of weather events, such as droughts, floods, forest fires, and severe storms. I'm not going to talk about each of these points, but I will just go over a handful. So if we look at agriculture, climate change may negatively impact crop yields, livestock production, and farming infrastructure, both from increased extreme weather events and long-term impacts of climate change. If we look at energy supply, Climate change could affect energy supply by disrupting energy generation and supply during extreme weather events. And I think what's going on in Texas, or just more recently, what had happened with their snowstorm is a good example of how that might come to be. Also, extreme weather events. So certain types of extreme weather events may increase in frequency and or intensity. And so that's going to be droughts, forest fires, heavy precipitation with associated increased risks of flooding, individual severe storms, and forestry. Warmer temperatures and reduced soil moistures create conditions for continued mountain pine beetle infestations. So warmer weather and more hospitable conditions means that they're coming from the west and going into Alberta. Our harsh winters have historically protected us from them, but now they're here and causing some major ecological damage. Grasslands displacing existing forest ecosystems, and also greater incidence of forest fires. So yes, that's a rough summary of how climate change impacts some of Alberta's physical and natural systems. And we're going to move to health, and I'll pass it along to Raluca.
Thank you so much, Maya, and good afternoon, everyone. So I wanted to start off the conversation on health first by touching on a subject that is very near and dear to our hearts as nurses, and those are the social determinants of health and how they interplay with respect to climate change. So as you may recall from our nursing programs, we've always tried to center our patients at the core of our practice, but with that, we always want to take into consideration how the social determinants of health influence every single individual, respective of their environments. And so when we speak to these in relation to climate change, what's really important to understand is that everybody experiences the impacts of climate change in unique ways, and everybody has different vulnerabilities, as Fiona mentioned earlier in the presentation. And so our role as nurses is really to try to understand how and who are those populations that are most impacted, and who are the ones who are most vulnerable throughout any climate change events. So for example, if we were to think about individuals who might be impacted by wildfires or flooding events in their communities, and we think about the idea of how people might bounce back, or we talk about resilience, that's when we think about the social determinants of health. So for instance, people who live in more urban settings are well known to have more immediate access to resources to help them cope, especially if they've experienced any losses. However, on the contrary, if we look to populations, and we know that there's a lot of people across Canada living in remote and rural settings, those people who would have been exposed to climate change events, especially if we talk about natural disasters, which will be on the rise as the climate worsens, they will have a higher disadvantage with respect to how they're going to experience health and what they're going to experience with respect to their health, especially when it relates to the inadequate access to health services. And so it's really important to think about how the social determinants of health also play a role with respect to how equity is upheld, and that's something that we try to promote through the work that we do also at CANE. The other thing I wanted to mention on this slide is with respect to how we as a country, and also more importantly, even as healthcare providers, must hold accountability and advocate for our Indigenous populations to have better access to quintessential services. And you might, of course, we know that Indigenous peoples experience significant disparities in their health as a result of having inadequate access to comprehensive health resources that can support their well-being. So there's still a lot of Indigenous peoples across the country who still live in areas that are under boiling water. And also, if we talk about something that is completely quintessential to life and survival, access to clean water, if we do not advocate for safer access, then we are continuing to perpetuate injustice, and by also posing a significant risk to the populations. So I'm just going to move on to the next slide to kind of dive into how, for instance, climate change impacts human health and how it contributes to exacerbation of existing inequities. So through this image is pulled from the CDC, the Center for Disease Control, and although this was something that was designed in the United States, it's still actually quite applicable in terms of the effects that we see here, depending on the context that you are living in. But I will just extrapolate air pollution from here, because we could spend the whole lecture just talking about the entire image. So for example, with air pollution, we know that we are going to see continuing rise in air pollution as a result of more particulate matter that will be in the atmosphere. And so, and that is especially even true when we have wildfire smoke events, which really aggravate the health of people who already have existing conditions like asthma, cardiovascular disease. In the same nature, we'll also see more prolonged allergy seasons. And so that being said, by exposing ourselves to this, we need to take into account how that can actually affect respiratory health for people who are both healthy, but also those who have current coexisting health conditions. So I'm not sure if you knew, but the World Health Organization recently published that approximately about 7 million people worldwide die annually just because of air pollution. And that is quite a staggering figure. And we as nurses, our role is really to capitalize on the opportunities that we have with our patients, be it whether you're working in the acute care setting or in the community areas, to understand how air pollution, for example, plays a role in the impact that it has on human health. And similarly with the other pieces that you see here, such as extreme heat and water and food supply, just to name a few. So, and I see one of the questions there. So I think that's going to be one of the ways that we're going to probably address it, is working on the moments and opportunities that we have with our patients to really emphasize on our health promotion and teaching, which is at the core of what we do. This additional slide also comes from the World Health Organization. And what I wanted to draw your attention to specific to this is that oftentimes when we talk about climate change impacts on health, we really like to dissect it in direct impacts versus indirect impacts. So direct impacts are those that stem from things like increasing extreme weather because of the rising global temperatures, which will lead to essentially those immediate health effects. And oftentimes, personally, when I teach about direct impacts, I also like to think about them as both acute, with those sudden onset, and chronic, what it can lead into the long term. So for instance, you see things like for people who are exposed to extreme heat will have higher incidence of dehydration. Some people will have a higher risk of dying, and of course a higher risk of hospitalization. On the other end, when we talk about indirect impacts, those are really the ones that stem to a disruption to essential services. So think, for instance, people who were exposed to let's say Hurricane Katrina or the hurricane that happened in Puerto Rico a couple of years ago. And so it's events like that, for instance, that can play a role in disrupting the essential services in health. And similarly with wildfires here in Canada that we've seen, for instance, how more people have visited the hospital, more people have experienced loss. So it's really understanding how those complex layers of exposure to increasing climate change related events will play a role in people's health. And that is where you as nurses come in to understand how these are actually completely directly related to your practice. And so seeing that relationship between environmental effects and impact on health really allows you to better understand your role and how you can best promote the health of patients. And this model, I wanted to just say that you can also add it to, you can also use it with other climate change related events that you saw in the previous slide.
Great. So let's put what Raluca talked about essentially into the Albertan context. So like I had mentioned before, in Alberta, we are going to see increases in extreme weather events. So that could look like thunderstorms or lightning, tornadoes, hailstorms, droughts or floods. And those events will result in injury, emergency situations where nurses are often required to be leaders, which we're also seeing again with COVID. Evacuations, and possibly even refugee crises. So with the Fort Mac fire, an entire city had to be evacuated. Extreme heat. That's going to result in more cases of heat stroke, heat-related deaths, and loss of working potential. This is going to be especially important for those who work outside or in non-air-conditioned workplaces. Increased temperatures can also result in an increased fire risk in Alberta. Air quality. The same climate harming pollutants, with the exception of carbon dioxide, are also very concerning for air quality and human health, as Raluca had mentioned. Their presence will increase and or worsen respiratory and heart conditions. Contamination of food and water and food security. So runoff from heavy rainfall can contaminate drinking and recreational water. There can be sporadic cases of and outbreaks of disease from strains of waterborne pathogenic microorganisms, which also leads to infectious disease in general. So with warming temperatures, disease vectors change. For example, ticks carrying Lyme disease living in the south can move further north due to the warmer climates. Furthermore, both human and climate-related destruction of ecosystems bring humans and animals closer together, giving more opportunity for diseases to spread, again, like COVID sort of did. So, Raluca, why don't you tell us a bit about planetary health?
Thanks so much. So yeah, planetary health is it's a new and it's an emerging field. The first we've heard of it was documented in about 2015. And so basically what's really important to take away from it, as you see in the image here, that it really is about the health of human civilization and the natural systems on which it depends upon. And because it's an emerging discipline, it has been recognized that it's really important to adopt a transdisciplinary collaborative approach, whereby you have a collectivity of voices that are working together with their expertise in finding solutions both locally and globally to respond to ecological and climate disruption, to undo the harm and create a viable desired future. It is also important to note that planetary health as an emerging discipline is also emphasizing the need for it to be adopted as an intergenerational responsibility. And that's where the consensus is that people of different generations should be trying to work together to try to resolve a crisis that unites us all. When I think about planetary health, typically speaking, we like to kind of break it down in the sense where planetary health is your larger umbrella, and climate change is one of those. It's a symptom that kind of falls under this larger diagnosis. And so oftentimes you'll see planetary health as including things like environmental changes, where climate change or biodiversity loss, water scarcity kind of fall under. And then on the other spectrum, you have how human health impacts come about. So for instance, increasing non-communicable diseases, infectious diseases, and so forth. And so when we look at planetary health, it's also important to understand that we try to adopt an approach that takes into consideration kind of an ecocentric approach to the way we try to plan the next actions that are coming up over the next few years. So for example, there's been a recent publication with respect from Nicole Redvers that spoke to bringing in the determinants of planetary health, and how by using, again, an ecocentric approach, this is something that's existed for thousands of years with among Indigenous communities. And so it's the protocols that really are founded on reciprocity, responsibility, and respect for planet's well-being as a living entity, or also known as the first or natural law. And so again, these are things that have existed for thousands of years, and it's our opportunity right now for us to really capitalize on how we bring them about in policy change. And so when we talk about the idea of safeguarding human health, but also the health of the planet, this is coming from the Lancet, and the Lancet has done a really beautiful job in creating infographics that are really engaging for all kinds of audiences. And these are some of the ways that are calling upon people to come together and to work towards the common goal of this idea of safeguarding our planet and ourselves and our health. And so some of the things that you can be doing, and I know Maya will be capitalizing on those towards the end of the presentation, but for instance, learning about planetary health, which you're doing right now, there is a high emphasis on reducing food waste. And I'm not sure if you knew, but about 40 to 50% of all the food that is produced is actually wasted. So, or it's actually never consumed. So again, it's thinking about taking an opportunity to think about how individual actions can play a role in promoting the health of our planet. And you may think that on a personal level that perhaps you're not, one individual action might actually not have any impact, but it actually can have an impact. And the changes we make can have immediate effects. Similarly, things like using water more efficiently. So really treating water as a finite source, because water is not infinite. So it's really important to how we think about the equity around water use around the world, and other activities that talk to ending deforestation, which a lot of the things have to do with consumer choices on products that we purchase in the markets. And last, another emphasis that I wanted to point to is the one for city planning. And so joining city councils and actually being able to participate at roundtables where we talk about designing cities that are more walkable, or that they have access to better public transportation, whereby we promote the health of people by getting outdoors and walking more rather than depending on cars, can not only play a role in the well-being of people by decreasing cardiovascular disease incidence, but can actually also play a role in promoting air quality. And so everything is very interlinked, and it's just a little teaching opportunities that we have, again, that we really should be using to the best of our ability in all our interactions with our patients.
So then we're at a point now where I think, some of us may be asking, what is the link between nursing and planetary health? I do hope that the answer is becoming a little bit more clear as we continue on with this presentation, but I'll hopefully solidify that answer for you right now. Nursing work is guided by a professional and social mandate which urges nurses to promote and restore health, alleviate suffering, and prevent illness. So that comes from the International Council of Nurses. So if climate change is threatening human health and society at large, then we as nurses have a moral and ethical basis to get involved. Furthermore, nurses comprise the largest group of healthcare professionals around the world, and we're consistently rated the most trustworthy profession out there. Considering all these aspects, nurses are in a unique position to take on leadership roles in addressing the climate crisis. They are very important liaisons between healthcare and the public and can communicate important climate health messages. In a nutshell, nurses are everywhere and well trusted. So this means that they hold a unique position to help advocate for change both within and outside the health sector, educate others on the climate issues, and help prepare communities for emergency events both before and after the fact. So we'll go to the next slide. And let's talk about what nurses can actually do. And I like to think that nursing work happens in kind of three main areas. So practice, education, and research. And I'm going to talk about each one. So when it comes to practice, practicing nurses spend a great deal of time with patients, and this privileged position allows them to assess patient health, monitor environmental hazards, and educate the profession and the public on climate health issues. Practice nurses also strengthen health systems by advocating for positive change within them. So an example comes from one study where nurses identified and objected to problematic hospital policies that dictated for them to dispose of narcotics down the drain. Many nurses recognize the environmental harms that these practices cause to the water supplies, and they successfully advocated for the development of alternative, more climate-conscious workplace policies. On the other hand, public health nurses are also really important players. Public health nurses work with individuals, families, and communities. In these settings, nurses are able to tackle the various levels of disease prevention. So primary prevention can include health teaching to increase older adults' knowledge on the risk of excessive heat, so what to do, how to stay safe, when to call for help. Secondary prevention could be immunizing individuals at risk of waterborne illness that may ensue from contaminated floodwaters. And tertiary prevention could include such services as supportive counseling to survivors of a hurricane or a fire. Nurses in the practice setting can also establish green teams. Nurses are effective leaders, and they can change environmental practices in our workplaces. The first step is to bring waste, a normal part of our background scenery, into focus. That is exactly what green teams do. Nurses and their intercollaborative partners develop green teams in an attempt to align their workplaces with the broader societal needs for a health system that promotes human health but does not harm the environment. So as Raluca had mentioned, it promotes planetary health. One nurse in Calgary that I know is working with AHS's sustainability office and has made huge waves in her hospital. She managed to get vegan and vegetarian options in the cafeteria, both for visitors and families, but also for patients to select from their meals. And you'd think that that would not be a big deal, but it actually was quite a lot harder to do than one would expect. But it also has an impact in the sense that meat is very resource intensive to farm, and plant-based diets tend to just be less impactful on the climate. So that's one way to reduce emissions. She's also working at creating a greening committee, which includes other site directors from other hospitals in the area. Green teams, as Raluca mentioned, they can tackle actions of all sizes. Some might seem really big and some might seem really small, but they all help and are necessary for the future. Then let's talk about education. There are many calls out there to start integrating climate change and environmental health knowledge into nursing curricula. Given how serious of a problem this is and how the health sector is going to be impacted, this isn't really a surprise. If nurses are going to be leaders in this field, they need to have a good knowledge base of this area and these issues. So one American group of nurses, the Alliance of Nurses for Healthy Environments, is working on the integration of climate change knowledge into nursing education by developing competencies, leading nursing outreach initiatives, which ultimately advance practice standards, and develop an electronic textbook on nursing, climate change, and health. I'm going to talk about what Canadian nurses are doing shortly, but we'll move along in the meantime. So in terms of research, there are lots of research opportunities for nurses in this field. Research helps us build links between the profession and climate action by asking hard questions about what our role really is, what can we do, and what needs to still be done. Research also helps connect the profession to other members of the healthcare team. For example, I conducted some research, and it ended last year for my doctoral thesis, and I looked at how Albertan nurses understand climate change and its links to health and nursing practice. And I also looked at how working in the hospital setting influenced their abilities to practice in environmentally responsible ways. So some of you might already be doing things like this, and we would love to hear from you. So maybe in the chat, if this is something, if you have an initiative, something going on, please let us know. We'd love to talk about it when we're done. And also, as a side note, international planetary health competencies for health professionals, including nurses, are coming out this spring. So subscribe to the Planetary Health Alliance if you want to get updated on that. You can check them out and try to see how you can integrate them in these competencies into your areas of work. So we'll go to the next slide. And we'll talk about CANE just a little bit more. I really think, CANE does advocacy, practice, research, we tackle all of these things, but I do consider the work we do, a lot of it is advocacy, whatever area it's in. And so nurses have been very successful in advocating for change, and by now, advocacy is considered to be an essential part of nursing work. Advocacy requires moral courage, or in other words, the ability to stand up for what is right, even if it means you may do so alone. Advocacy is supported by both the nursing professions of North America, and both the CNA and the ANA have official position statements on climate change. CANE represents Canadian nurses who are pushing forward on this frontier by supporting nurses in their work, whether it's research, education, or practice, or even policy development, things like that. Members of CANE continue to advocate for the planet and the climate in several ways. So we have worked with the CNA to develop position statements and have worked with them to conduct nursing research. Recently, we sent out a Canadian-wide survey trying to understand nurses' environmental health knowledge levels. Our members are working with CASN, and for those of you who don't know, that's the Association for Schools of Nurses in Canada, and they standardize our curriculums across the country. And so we've worked with them to update nursing curricula so that it includes environmental health concerns like climate change. Our first module is almost done. I think it actually might even be out by now. And it talks about vector-borne diseases as they relate to a changing climate. We've also worked with other healthcare professionals like CAPE, which is the physician counterpart, to lobby politicians to develop comprehensive climate action plans. And we're developing a Nurses Drawdown Challenge, trying to engage nurses across the country to help their workplace reduce waste and emissions. We also have an intersectionality group, and we've been writing letters to members of the federal government to advocate on behalf of Indigenous groups in Canada. We do have a webinar coming up, and that is going to be with an Indigenous activist from Haida Gwaii, and it's called Indigeneity and Environmental Racism in Canada. And it's a conversation with Sandla Nee-Gid and Raven Ann Pochka, and it's on April 20th if anyone is interested. The webinar is going to provide nurses with information about what is environmental justice and racism, present communities that are impacted across Canada with a focus on Indigenous communities, and speak to actions that we can take to address these inequalities. If any of this type of work seems like it might be interesting to you, then we definitely want you over at CANE. Your voices and your presence are deeply valued, and we would love to have you join our team. And so just to end us off here, we'll go to the next slide. We do have recommended resources available here. So maybe if this is something that is interesting to you, you can contact one of us or even Patrick, who helped us organize this event, and we can send you this list. And if we go to the next slide, we also have several recommended documentaries that we think are worth the watch. And then one more slide over. We do also have several links of ways to get involved. So of course we have our website link to CANE. It is under construction, so it looks a little bit rough right now, but it will come along. And then yes, there's multiple other things that that if you're interested, you can get involved with. So we will go to the last slide, and I'll just like to say thank you on behalf of me and my team. And we would love to take your questions or have a discussion about any of these things that we just talked about.